My name is Harleigh Drum, and I chose breast cancer to be my topic. What is breast cancer? Breast cancer is a type of cancer that starts in the cells of the breast. It happens when abnormal cells in the breast grow and divide rapidly, forming a lump or mass known as a tumor. These cells can invade nearby tissues and may eventually spread to other parts of the body through the blood or lymphatic system. Signs and symptoms. Some signs and symptoms could include breast lump or tissue thickening, breast pain, swelling of all or part of the breast, bloody discharge from the nipple, sudden change in the shape or size of the breast, nipple caving in, breast skin discoloration, lump or swelling under the arm. Types of breast cancer. There are many types of breast cancer, but they are broken down into two main categories, which are invasive and non-invasive breast cancer. Types of non-invasive breast cancer. Non-invasive means the cancer has not spread from the original tissue. Ductal carcinoma in situ is where the cancer cells are yet in the coniferous ducts in the breast, and they haven't invaded the surrounding tissue. Lobular carcinoma in situ is cancer that grows in the milk-producing glands, and the cancer cells haven't invaded surrounding tissue. Types of invasive breast cancer. Invasive ductal carcinoma is the most common type of breast cancer. It is in the milk ducts and invades nearby tissue. Invasive lobular carcinoma first develops in the breast lobules and invades near tissue. Inflammatory breast cancer is rare but aggressive and makes up 1 to 5% of all breast cancer cases. It blocks lymph nodes so the lymph vessel cannot drain. Paget disease of the nipple is cancer that begins in the duct of the nipple, and as it spreads, it affects the skin. Triple-negative breast cancer is rare and affects 10 to 15% of people with breast cancer. Angiosarcoma is a cancer that grows on blood vessels or lymph vessels in the breast. Risk factors include ones you can control and ones that are out of your control. Ones you can control would be the alcohol use, hormone therapy, and an unhealthy lifestyle. And ones that are out of your control is your age, having dense breast tissue, your genes, your family history, and not having a baby. People who have never had a baby are more likely to develop breast cancer. Diagnosis of breast cancer. Most doctors will complete a physical exam along with a breast exam. A mammogram is an X-ray image of the breast and detects abnormalities in the breast tissue. A breast ultrasound uses sound waves to create a picture of the tissues in your breast to help the doctor distinguish solid mass. The breast biopsy is where they remove a tissue sample and send it to the lab to test it. Breast cancer stages. To determine the stage of cancer, the doctor must know if the tumor is invasive or non-invasive, the size, if the lymph nodes are connected, and if the cancer has spread to other areas. There are 5 stages of cancer, stages 0 through 4. The smaller the area of cancer, the lower the stage. Stage 0, ductal carcinoma in situ. The cancer remains in the ducts and has not spread to any nearby tissue. Stage 1A, the tumor is 2 centimeters wide or less and the lymph nodes are not involved. Stage 1B, there is no tumor in the breast or is smaller than 2 centimeters, but cancer is found in nearby lymph nodes. Stage 2A, the tumor is 2 centimeters or less and up to 3 nearby lymph nodes are affected, or it's 2 to 5 centimeters and hasn't spread to any lymph nodes. Stage 2B. The tumor is 2 to 5 centimeters and up to 3 axillary lymph nodes are affected, or it is greater than 5 centimeters and has not spread to any lymph nodes. Stage 3A. Any size tumor and 4 to 9 axillary lymph nodes are affected, or if the tumor is greater than 5 centimeters and 1 to 3 axillary lymph nodes are affected. Stage 3B. The tumor has entered the chest wall or skin and possibly entered up to 9 lymph nodes. Stage 3C. Cancer is found in 10 plus lymph nodes and is not confined to just axillary lymph nodes. Stage 4, also known as metastatic breast cancer. A tumor of any size where its cancer cells have spread to near and far lymph nodes as well as faraway organs. Treatment. The cancer's size, stage, and grade will determine the course of treatment to be used. The following are some types of treatment. Surgery, which is the most common treatment to remove breast cancer, along with radiation therapy, chemotherapy, and hormone therapy. Treatment in depth. Surgery. A lumpectomy removes the tumor and some surrounding tissue. The sentinel node biopsy and axillary lymph node dissection are surgeries to remove lymph nodes. A mastectomy is where they remove one breast, and a double mastectomy is where they remove both breasts. A contralateral prophylactic mastectomy is where they remove a healthy breast to lower the risk of developing breast cancer again. Chemotherapy is a drug treatment, usually used along the side of surgery, and is used to destroy cancer cells. Radiation therapy. High-powered beams are used to target and kill cancer cells. It is used externally, but there is an internal radiation therapy called brachytherapy. Brachytherapy is a type of treatment where they place radioactive seeds right next to the tumor to deliver radiation and kill off the tumor. Hormone therapy. It blocks body's production of hormones or blocks the hormone receptors on the cancerous cells. It is only used if the body is sensitive to hormones. The hormones used are estrogen and progesterone. It can slow or stop the growth of the cancer. Prevention. Have a healthy lifestyle, having a nutrient-dense diet, breast cancer screenings, and self-exams looking for lumps in the breasts. Breast cancer outlook. Breast cancer survival rates are increasing. The factors that go into determining the outlook of breast cancer is what type an individual has and the stage of the cancer at diagnosis. Other factors can include age, race, sex, and the growth rate of the cancer. Survival rates. Localized cancer has a 99% survival rate, regional at 86%, distant at 31%, and all of them combined at 91%. Did you know men can get breast cancer too? While it is rare, it is possible. 1 out of every 100 breast cancer cases in the U.S. is a male. Everyone is born with some breast tissue, and breast cancer can affect males differently. And then my works cited.